Hello everyone, this is Dr. Sushma Sarilla, consultant doctor at Fidicus Homeopathy. What are the investigations? Remember, though urticaria is just a skin manifestation, it can have its roots in the systemic parts as well. Like even if your liver or your kidney is affected, you can have or present with urticaria. So let's dive into the investigation topic where you will know in depth what is the cause of urticaria. Primary is clinical history, lab tests, allergic sensitivity tests, clinical suspicion tests, and skin biopsy. What is clinical history? See, not all kinds of urticaria need investigation. So, first, when a patient comes to us, what we need to do is take a proper history. So, what does the history include? It includes onset, like is it sudden or is it slowly developing? And then, what is the duration? Like, is it less than 6 weeks? If it is less than or equal to 6 weeks, we consider that as acute urticaria. If it is more than 6 weeks, then we consider that as chronic urticaria. And what is the pattern? Like for example, are you suffering from top to bottom, or if you're suffering only in a certain area like in your thighs or in your hands or in your face, it depicts what kind of urticaria it is. Then coming to exposure to allergens, what sort of allergic reaction you're having after exposure. For example, you've had some food and then you've started developing these red welts all over your body. Is there any trigger? We will note even that also. And then associated symptoms. If you have urticaria along with fever or joint pains, it might depict that there is systemic involvement. As well as genetic history. If your father or mother are allergic to some kind of food or some kind of insects or pollens, then there is a chance that you will also have that allergy trigger. Coming to the lab tests. Of course, there are a lot of lab tests for urticaria, but it depends on the pattern, onset, and how your urticaria has been developed. First is your CBC or complete blood count. See, in your complete blood count, if it is acute urticaria, you will have raised neutrophils. If it is chronic, you will have raised lymphocytes. So, based on the inflammation duration, we can see by CBC what kind of urticaria it is. ESR. ESR is erythrocyte sedimentation rate, where it will tell you if you have any sort of infection in your body, and that is why you're developing urticaria as a secondary symptom. Remember, it can present as a secondary symptom with a deep underlying cause. Then we have CRP, which is C-reactive protein, which can also tell you about the inflammatory condition in your body. And then LFT and RFT, which is liver function test and renal function test. If there is any hepatitis condition like hepatitis A, B, or C, or if you have any renal problem like renal failure, acute or chronic, it can present starting with urticaria, or urticaria can begin in the middle of the disease as well. So by knowing these levels, we will know if it has a deeper cause or if it is the primary presentation. Next, TSH. Even in thyroid, like hypothyroid or Hashimoto's thyroiditis, you can see urticaria presentation. And then ANE, anti-nuclear antibodies and rheumatoid factor. These two contribute for the autoimmune part of urticaria. For example, you're suffering with systemic lupus erythematosus or SLE. Or if you're suffering from rheumatoid arthritis, many people just think it is about the joints. But remember, rheumatoid arthritis can also have a secondary feature called as urticaria, a skin presentation. And even raised ANA and RF can indicate collagen vascular diseases as well. IgE, C3, C4 and CH5. The total IgE level will tell you if you are having an allergic reaction in your body. And then C3, C4 and CH5, which is complement system, which is also a part of inflammation, will tell you if there is inflammation in your body or not. So these are the lab tests which are needed for urticaria. Next, another test which we can do in our clinic is SPT or skin prick test. For example, we have taken your case and we have noted what are the allergic reactions you are having after certain things. For example, it can be food, it can be insect bites, or it can be any other things, like for example, drugs. We will take a part of that or a part of the allergic reaction you're having due to a certain food. We will place it on the back of your body. We will put a drop of it and then we will prick the skin with it. See, this is how a skin prick test is done. These are the assumed allergens. So one drop of each allergen is put, and on top of that we will prick it with a needle, and then we will wait for about 12 to 30 minutes. And if they have raised welts near that area, it means they are allergic to that kind of allergen. And then we have specific IgE test. So what is specific IgE? IgE can be measured in two levels. One is total and one is specific. If there is total rise, it will tell you that you're having an allergic reaction. But the specific IgE test will tell you what sort of allergen you're allergic to. Next is oral food challenge, especially in countries like India. If there is any allergic reaction to food, then it can be because of fish or prawns. Or if you're going abroad like USA or UK, they might be having allergy to peanuts or shellfish. So to know what kind of food you're allergic to, the patient under the supervision of doctor is sat down. They are given a smaller amount of food of each kind and the reaction is noted. So if because we are giving very smaller amounts, the allergy reaction will be also very minor and the reaction will be noted and we'll know what sort of food you are being allergic to so that we can prevent the trigger. Next, other tests, infection screening. For example, in your routine test, you're having some sort of problem in your SGOT or SGPT levels in your LFT, or you're having some increase or decrease in your BUN or creatinine levels in your renal function test, then we can do some deeper tests to know the liver function or the kidney function or overall body function through infection screening. And also we can screen for H. pylori or hepatitis B, C or A. Cold stimulation. Remember that even physical triggers can cause urticaria. For example, cold can also cause urticaria. So we can do cold stimulation test where the person is exposed to cold and we will see if they have an allergic reaction to the physical trigger. The same goes with the heat challenge where the person is exposed to sunlight or to steam to see the allergy reaction of the person. And then what is dermatographism? As you can see in this picture, this is called as dermatographism. The clinician or the doctor will take a tongue depressor and they will start to write or draw a pattern on your skin. And after 5 to 10 minutes, whatever pattern has been drawn on your skin will represent as a raised wheal or a raised welt. As you can see, they have drawn a pattern and you can see raised skin all over the surface due to allergic reaction. If they are positive for this, then that they are called as positive for dermatographism or positive for urticaria. And then drug provocation test. There are some people who are allergic to certain kinds of drugs. So those drugs are given under the clinician or under the supervision of a doctor and they will see if they are allergic to it or not. But the doses are very milder. And then skin biopsy. For example, if you're having urticaria for more than 24 hours and also you're suffering from fever and the urticaria is very painful, then you need a skin biopsy to know what is the underlying cause. Now coming to the consultation part, here at Fidicus we have two kinds of options. One is online consultation and offline consultation. If you're staying nearby our nearest branches, then in person would be a good choice. Or if you're staying far away from us and you have different working zones or time zones, or if you're anywhere across the globe and you want to reach out to us, you can call or WhatsApp us on the number which is given here. We have two types of online consultations. One is audio online consultation and the next one is video online consultation. For example, you have already done a doctor consultation and you need medication. Here at Fidicus, we provide you with medication also. Your medication will be shipped directly to your home or directly to your doorstep. For example, if you're staying in India, it will take about 3 to 4 days for your medicine to reach you. If you're staying in USA, it will take about 3 to 5 days to reach you. If you're staying across anywhere in the globe, apart from USA and India, it can take about from 4 to 8 business days for your medicine to reach you. If you're suffering from urticaria and you would like to take homeopathic consultation, do call or message or WhatsApp us on this number. Why do you want to choose Fidicus Homeopathy? See, here at Fidicus, we stand tall with the highest success rates. We have almost have good success rate in all of our cases and also transparent treatment. What do you mean by transparent treatment? Here at Fidicus, we will be discussing with the plan of action of our treatment, and also there is no gray area in between. There's just black and white. And then the Fidicus personal care is top notch. So next time you want to take treatment, try Fidicus Homeopathy. Thank you.